One of my children has a primary health complaint,
Yes.
which is not mental health related, and I'm neurodiverse, so within the family is this concern. When he's going through paediatrics, how will he access diagnosis?
Well, paediatricians can certainly diagnose autistic spectrum and ADHD, and do frequently. There are arrangements between paediatrics and mental health, and sometimes we have a discussion about which service is actually the best place to see a young person, and occasionally the paediatrician and one of the child psychiatrists will have a conversation, or the people at CAF Link will have a conversation at the initial referral stage as to which service is the best. And sometimes people will spend time in developmental paediatrics and then will be referred on to CAF for another piece of work. It just varies individualised.
So it doesn't matter where you start?
If the primary question is more around autistic spectrum and the young person's under 14, it's best to start at paediatrics because they're best placed to make that diagnosis. Whereas if it's more ADHD, it tends to be CAF that will do that piece of work first. Often, whichever service has them, they may go ahead and do other diagnoses, or they may switch between services depending on the issues and what we feel is most helpful.
Another of my children is under CAF and now has a new primary complaint that's physical. What happens then?
Well, the primary complaint that's physical, I guess, would be dealt with by the GP and or paediatrics, depending on the nature of it. The CAF service would stay involved depending on whether there's work for them to do as well. So, for example, we do have a number of young people who have physical conditions with significant psychological issues that we still see. Sometimes those young people are seen within the paediatric consult liaison service, which has child psychiatrists and psychologists in it, and sometimes they're referred through to the mental health service. Sometimes, for example, things like if a young person has, say for example, seizures that are thought to be more psychologically based rather than physically based, they might be referred through to mental health services for a longer piece of rehabilitation work or other kinds of cognitive behavioural acceptance type therapies.